Hello, my name is Penda Boma and I'm going to be performing the Foley catheter insertion video on the female patient. For this video I have my washcloths, I have a clean pair of gloves, and I have my Foley catheterization tray, my catheter kit. I have my patient covered right here, the dummy, and I am ready for my procedure. What I do is I get in the patient's room, knock, 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 patient lets me in. I get in the patient's room, I introduce myself. Hello, my name is Penda Boma, I'm going to be your nurse for the day. And then I close the curtain to provide patient privacy. After introducing myself to the patient, I'll explain to them the procedure, what we're about to do today. Today, according to your doctor's order, we are going to be inserting a catheter. We're going to be doing a catheter insertion. Make sure the patient understands the procedure. I'll go ahead and ask for their name and date of birth using the two-step identifiers. What's your name and date of birth? Tell me their name. I check their wristband to make sure that it matches the patient. We have the right patient, and at this time we're going to go ahead and start our procedure. I will perform hand hygiene again in front of the patient to make sure they are comfortable, and I will ask if they have any allergies. After I do that, I'm going to position the bed into a nice working position, and I'm going to reposition my patient into a nice dorsal position. I go ahead and put on my gloves. Once I have my gloves on, I will then ask the patient to lift their hips up and open their legs so that we can have a good walking space, and ensuring that my dominant hand has access to the base of the patient. It is also important that I put a mat, waterproof mat, under the patient so that the bed does not get wet. At this time, I'm going to ask my patient if it's okay that I expose them. Patient gives me consent. I open the patient. And I'm going to ask consent to the patient if I could touch them, because now we are exposing their perineal area. Patient gives me consent. I go ahead and assess. As I'm cleaning the patient, I grab my first washcloth, opening the labia of the patient. I clean from the outside to the inside. So I clean using a good soap solution, approved soap solution. I'm gonna start cleaning my patient from the farthest labia up, down, to the closest labia, up, down, and in the middle, up, down. I get my second cloth for rinsing. Do the same procedure. Clean the patient from the furthest labia, up, down. The one close to me, up, down. And in the middle, up, down. My last cloth is for drying. I'm going to make sure I'm doing this very calmly and gently. From the farthest labia to the closest, up, down. Up, down. And up, down. Patient looks good. Accessing the patient's perineal area. There is no redness, no discoloration, no odor, nothing unusual. So I'll go ahead and take off my gloves, put that in the trash, perform hand hygiene, and I'm going to grab my catheterization kit. I could use this like my trash, or I can toss this. So I'm going to open my kit from the furthest, and then the sides, and then the one closest to me. At this time, I'm going to grab my sterile gloves. Open up my sterile gloves. Make sure I stay within the 1-inch border. Make sure that I stay in the 1-inch border, and I want to make sure my sterile paper opens all the way. So at this time I have access to my sterile gloves. I'm going to start with my non-dominant hand, which is my left hand. So I pinch that sterile glove, work my way in. Stay within that cuff. Making sure I'm staying within that cuff. And I don't have no jewelries or no watch as I'm putting on my sterile glove. My non-dominant hand is on, so I'll go ahead and use my 2 fingers, making sure my thumb is not exposed. My thumb is exposed as I work my way in to put on my sterile glove. Got it? So I'm going to go ahead and work my way through while I'm staying within that sterile field, maintaining that cuff. Slowly working my way up. Okay. My gloves are on now. I'm ready to perform my procedure. I can move this to the side, but I'm just going to let it sit there. So right now, I'm going to pick up my blue drape and put it, ask my patient to lift up so I can put it under them with the shining side facing down. Here's my blue drape, shining side facing down. I'm going to move this kit a little bit to the side, maintaining sterility. Now that I have my drape, my blue drape down, I'm going to go ahead and put on the dressing on the patient. I have my dressing on the patient. So at this time I'm going to advise my patient that it is very important that they don't move, as I'm going to start working on them in order for me not to break my stereo area. This is my kit. I'm going to move it back, arrange it towards me, staying in that stereo field. Okay, I'm going to grab the tools. Right now, I need to arrange my alcohol swabs so that I'm ready to use them when I'm ready to use them right away. Got my alcohol swabs ready to go. I'm gonna grab that loop, put it right there, drop that in the trash. Grab that tip of that catheter. I'm going to take out the plastic, put it in the trash, and drop it right in the loop. Okay, and at this time I'll go ahead and set up my syringe. Go ahead and set up my syringe. Okay, now that I have my loop, the tip of my catheter in the loop and my syringe is set, I'll go ahead and tell my patient I'm about to start cleaning them. They should be calm and I will take care of them. So I start with the first alcohol swab. As I touch my patient, I'll start cleaning from the farthest labia all the way down, toss that in the trash. Get my second alcohol swab there. The closest labia in the trash. Alcohol swab is running away from me. Got it. Third one in the middle, from the top to the bottom. Okay. Now that I've cleaned my patient, I will go ahead and get the tip of the catheter. I'm going to insert it about 3 to 4 inches into the patient until I see urine. Okay, there goes the urine. So I'm going to secure that tip right there. And I'm going to pump the balloon. As I pump the balloon, I will give it a little tug to make sure that it is firm. Okay, my catheter is inserted, it is firm, and The patient is ready to go. For the sake of your remediation, I was asked to stop when I take off the syringe. So this will be the end of my remediation. Thank you.